Welcome to video 2 of chapter 15. In this video, we will look at physical illnesses and mental disorders, at least very briefly. Obviously, regular checkups are very important for children as well as adolescents. I mean, just to make sure that physical illnesses and mental disorders are identified as soon as possible. It's always better to catch these things earlier rather than later. What follows here are ways to help prevent the spread of common illnesses once children start school. We want to make sure that they know these healthy habits. Hand washing, toothbrushing, sneezing into the crook of your arm, and this helps to not necessarily always, or it helps to avoid common illnesses, but also helps to avoid spreading common illnesses. Um, these things are probably being taught now more than ever, obviously with the pandemic and the coronavirus, but they've always been important to help prevent spreading illnesses. And it's obvious, I say, like, you want to make sure that they know this before starting school, because that's when illnesses really start to spread. This applies to having immunizations as well, which is why school systems require that children have certain immunizations before they can start public school, so that they're not spreading serious diseases or illnesses. So here's a list of a lot of the common immunizations that children should have early in childhood. Um, most of these are early in childhood. The HPV vaccination is for adolescents. This is most effective if it's administered before the adolescent becomes sexually active. So typically, you look at the ages of 11 or 12 to have a young adolescent vaccinated before hopefully this is before they've become sexually active. Um, most childhood illnesses are what we call self-limiting, meaning that they resolve without needing any medical attention or intervention. This would include things like a child getting diarrhea, or sore throat or cold. I mean, these are things that we don't have to rush to doctor to solve, unless they're prolonged or extremely serious. So they're called self-limiting because they correct, with just rest and fluids, they can correct themselves on their own. They kind of run their course, and then the child gets better. However, there are obviously also possible long lasting illnesses, which we call chronic illnesses. These do not resolve spontaneously and cannot be cured completely in most of the cases. There often is no way to completely cure a chronic illness. So this includes such things as asthma, which is, as it says here, the most common chronic illness, diabetes, sickle cell anemia, cancer, HIV/AIDS, cystic fibrosis, epilepsy, congenital heart problems, cerebral palsy, and seizure disorders. So once again, these are called chronic illnesses because they tend to persist over the course of years, or even in many of these cases, these are lifelong illnesses that individual needs to learn to deal with properly. Okay. About 25% of children in the U.S. live with at least one of these conditions. I mean, a lot of these are really serious, but I mean, there are a ton of, of children that with asthma. That makes up a good portion of that 25%. So about 1 in 4 children have some kind of chronic illness. We have pediatric psychologists and child life specialists who can help both children and their families. These categories of professionals, they help children and families deal with serious health threats and serious medical conditions. And so that it's not just about, these aren't like doctors that are trying to, solve the child's problem. They're teaching the family, the parents and the child, how to live with and how to manage their health condition. The second category, the child life specialists, they're this is a kind of a relatively new specialty. We've had pediatric psychologists for a long time, but child life specialists, I don't know how many years it's been, but it's a pretty new category, and these are pediatric healthcare professionals who work with children and families within hospitals and or other settings to help them to cope with the challenges of long-term hospitalization, the challenges of illness, the challenges of the disability they might have. So, in particular, they are trained to help the family as a unit, um, to deal with the ongoing chronic illness. Okay. Um, so these last couple of slides they're a real nice chart. This is table 15.2 in your book. It spans 2 pages, 589 and 590, and it goes over a whole list of physical and illnesses and mental disorders. And as you can see, there's chapters mentioned because most of these we've dealt with in earlier units. So the ones that come from earlier chapters, you're not going to be responsible for knowing them to any kind of depth, but they are in this chart here in chapter 15. So I could ask you about any of these uh, mental disorders listed here, and if I did, it would, if it's one that came in an earlier chapter, it would be a pretty simple question. But it is useful for you to look at this chart, this one and the one on this page as well. I mean, it spans 2 pages. Make sure you have kind of an idea. Just kind of go through it mentally. Do I know basically what this is? Do I know what autism spectrum disorder is, schizophrenia, eating disorders, etc.? And most of these you might already have knowledge about. So make sure there isn't one that you say, wait, I have no idea what that is. If that's the case, just look in this chart. You don't have to go back to the original chapter, but I wouldn't ask you anything beyond what's in this chart. And once again, if it comes from an earlier chapter, like most of these do, I'd probably ask you a fairly simple question about it, if anything. The ones that you need to know in more depth, we're going to cover later. These are the last two listed here. PTSD, we're going to talk about later in this chapter, as well as substance use disorder. So I could ask you more about those two in particular. One thing I'll give you before I leave this video is one little statistic I did want you to know. In any 1 year within the U.S., between 13 to 20% of children and adolescents experience a mental health disorder. So, I just want to give you a bit of the scope here. So 13 to 20% and this is just looking at mental health disorders, not the chronic illnesses and physical illnesses we were looking at earlier. This whole chart here is mental disorders, and so 13 to 20%. So it's somewhere in the neighborhood of, between 1 in 5 and 1 in 6. Maybe between 1 in 5 and 1 in 7, let's say, of all children, in the U.S. per year, children and adolescents experience some form of mental health disorder. Some of these are much more common than others, but I just want you to know it's a pretty high figure. It's a mental illness is certainly fairly common, and more so in adolescence than in childhood, but many of these do affect children as well. We talked about some of these in earlier chapters, the ODD, for instance, and disruptive mood dysregulation disorder. Those are more with children rather than adolescents. Attachment disorders are more with children. Certain communication disorders. Okay. Anyways, that's all I wanted to do here, and this will conclude video 2 from chapter 15.